I'm now going to show you the application of acupuncture for low back pain. And I'll first show you here with the local points along the low back. So you'll have your client face down, and the first point I'll show you is level with the spinous process of L2, the second lumbar vertebra. And some people have really prominent vertebral bodies of their lumbar spine, making it really easy for you to palpate down. But in most cases, you can find the lumbar vertebra, their bony prominences easily, and identify them by finding the iliac crest. So this is the crest of the pelvis. And you'll find where your hand just falls off of the crest of the pelvis into the thorax. And this is level on the majority of people with the spinous process, the lower border of L4. So once you've located the spinous process of L4, that's the bump on the back of the spine, then you can just walk it up. So this would be 3, and then this would be 2. So now we have located the landmark here for the spinous process of the second lumbar vertebra. And this is going to be on the urinary bladder channel. We're working with low back pain, we're working with the urinary bladder and the gallbladder channels. So now you're just going to find this urinary bladder line. So we have our landmark here of L2. So just find your way out to the outer urinary bladder line. And this is going to be basically on the edge of these paraspinal muscles. And the idea that we're aiming for here is we're aiming for the quadratus lumborum muscle. And this is that short muscle that goes in between the crest here of the pelvis and then all the way up to the bottom of the rib cage to T12. So we're working on this muscle, which causes a lot of back pain. So once you have your landmark, walk your hand across, and you can just you have a nice way to palpate this muscle. And I always like to needle this point towards me. It's a little bit easier to pull a needle towards you than it is to push a needle away from you. So if you can be on the side of your client where you're going to be able to pull the needle towards you. So find this outer border. We're on the outer urinary bladder line, lined up with L2, and then you insert your needle, and you're going to go transverse oblique straight towards the midline, and you'll really feel the needle come up against those fibers of the quadratus lumborum muscle. And as long as you're keeping your needle nice and transverse, never do a perpendicular insertion here, you're in a safe zone because you're directly into the muscle. If you start to go perpendicular in this zone, there are kidneys directly under here, so keep your needle going this direction and you'll stay safe. I like to pair this needle also with a Dui Yao, so you can also find either above or below this first needle that you placed about 1/2 to 1 inch, and you'll do the same insertion. So this transverse insertion towards midline, working to place the tip of the needle directly into the body of the quadratus lumborum muscle. And that will really help to dispel the stagnation. So if there's any sort of long-term chronic pain going on in the back here, often this muscle is affected. So it's a nice way to really help to bring fresh qi and blood to this area in the body.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.